Hi guys, it's Nick. This gentleman is one of my regulars. He comes in about every 6 months. He has a very rare genetic condition which I'm not going to name because it's so rare you'd almost be identified by it. But basically he can't have microsuction because he's got quite loud tinnitus. He doesn't like the idea of having irrigation. And to be fair, I think this would be perfect for microsuction, but the patient's got very loud tinnitus, and the last thing I'd want to do is upset him. So we're using the Jobson horn as he prefers, and he quite likes. I think, to be honest with you, he quite likes just to sit in front of the video camera or in front of the video screen and watch what's going on, which is great for me. The slightly worrying thing is sometimes when patients are sat here watching the screen is they start moving their head with the angle of the instruments. But this is coming out very nicely. Now, you'll notice this is very soft wax. So unfortunately I'm not going to be able to collect the wax at the end of this because this is literally going in a tissue. Sometimes when it comes out in a big hard mass, I can show you what it looks like afterwards. But this one is very gooey, and he comes in about every 6 months, and I do suspect there's a combination of the fact that he wears hearing aids, so he's got a foreign object in his ear, so his ear produces more wax, and he's on a lot of medication, a lot of steroids to help with his condition that he's got. But we just take our time. It's quite a long process for me. I've obviously edited this down, but there are times that when I'm doing this, I know people say that the camera's a little bit shaky, or why you're not doing this. I have to stop sometimes, because even though I may have the patient on a couch and I've got my arms rested, I intend to be doing this profession a lot longer, so I want to try and look after myself. So when I start to get a little bit of tension across the back of my shoulders, I'll just stop, put my arms down, get a bit of circulation back in, and off we go. This is coming out quite nicely now. I'm now going to do some dry mopping, and that's literally where we put a little bit of surgical cotton wool on the end of the other end of a Jobson horn, which is serrated, so that we actually just spin the cotton wool onto the end of the Jobson horn. The key to remember is then to spin it the same way, because what you don't want is if you were to spin it the opposite way, it would then unload inside the patient's ear, and then you'd find yourself removing the Jobson horn with no cotton wool on, which I have seen occasionally. Colleagues have sent patients that have lost bits of cotton down inside the patient's ear. So I'm just giving this, as I like to say to my patients, I'll just give this a little bit of a buff up. But we've got one little bit of annoying bit of wax there which we want to remove. So I'm going to go for a slightly different instrument. This is called a spoon. It's not my teaspoon. It's just a wax tool that's got a slightly different end to it, and that's just helping me just remove that wax. You'll notice, unlike a lot of other audiologists or audiology videos you see, I don't do a lot of chiselling down the sides of the ear canal, and hence with the 40 odd videos that I have posted on YouTube, you don't see any of my patients that are bleeding. For me, if I see a patient that's got an ear that's bled, that is my fault. That's lack of care, and so that's why sometimes I'll just use a different instrument. But I don't like this idea of chiselling down the sides willy-nilly, not knowing what you're doing. But there you go. It's nice and clear now. I'm just going to remove this last little bit just on the left-hand side here. And we're all done. So I'm sure I'll be seeing this chap in another 6 months. Stay tuned, by the way. I've been a little bit slow on the videos, but there's some very exciting news coming mid-May 2016. So guys, like me on Facebook and you'll find out what about to happen. Take care.